Hi everybody, I'm Adam Del Conte and I'm a medical director at Midwest Express Clinic, and this is Ask the Expert. Welcome to March. So hopefully spring is in the air, though probably snow still is as well. And of course pollen is probably in between melts sneaking its way out. So many of you, myself included, are probably dealing with the joys of seasonal allergies. And there are many things we can do that hopefully can help control or in some cases eliminate the symptoms of these allergies. So allergies can affect us in all sorts of different ways. For most of us, if we're talking about seasonal allergies, it is more that joyful combination of congestion and runny nose where you can't quite blow your nose effectively because it's so stuffed up. And there are plenty of things we can do. In many cases, prevention can be more helpful than treatment. So if you've tried before one of the over-the-counter antihistamines, taking these daily can help decrease your body's response to the irritants or the allergens that are getting you running, and that by itself is a great first line. Other options that kind of bridge the gap between prevention and treatment would be some more natural things to try. There's a craze going on of the neti pot, where you pour the salt water in one nostril and out the other. As goofy as that may sound to some, that is actually a really excellent treatment for helping to flush out and clear the nasal passages, and the salt water helps kind of decrease some of that inflammation in there and break down any bacteria or other irritants that are trying to take advantage of your inflamed state from your allergies. If the idea of a little pot freaks you out too much, they have other options, including just a simple mist spray or a very gently pressurized canister that does all the work for you. You don't have to mix anything up in a tiny teapot. Another great resource for people with seasonal allergies would be a medication called fluticasone nasal spray. It's got a couple different brand names and it's available without a prescription these days. And that is a steroid, an anti-inflammatory that really works directly on the tissues of the nasal cavity and near the sinuses and can kind of help decrease that inflammation that's brought on by allergies. But I know some folks aren't a real big fan of medications over the counter or otherwise. And there is some wisdom to the grandma-grandpa style medicine. I talked to some of my patients with sore throats from their postnasal drip and allergies. The high tonicity of salt water creates an osmotic gradient that pulls the fluid from the tissues in your throat and your nose into the salt water. The decreased pressure inside decreases the stretch on the tissues and the nerve, and you feel better. My only real recommendation is give that gargle or that rinse a good 30 seconds, because the more time exposed to the high salt water, the more swelling and pulling out of fluid can really happen. And for some of you that aren't really sure if you have allergies or a bit more worried about food allergies and sensitivities than seasonal allergies, there are a couple of options open to you. Most clinics or laboratories are able to do some blood tests that look at your body's immune response to certain different things, whether it be types of tree pollen, grasses, foods, pets. And then if you're having a little bit more concern or wanting to have a bit more specific information, or if you're feeling like your allergies are a bit more out of control, getting a referral in to see an allergy specialist, they can do a special test where they put small scratch marks on an aspect of your skin and put little bits of concentrated allergens over that, and then are able to chart based on your little reaction what is a true trigger for you and what they can kind of help tailor your treatment towards. Your primary care provider is more than happy to help get you tied into a specialist if that's what you need. So thanks for watching this episode of Ask the Expert. For any of your urgent care or primary care needs, please swing by into Midwest Express Clinic. We service a great portion of Northwest Indiana, and if you feel like taking a road trip, we've got clinics in Chicago and the surrounding suburbs.